Hi everyone, this is the second part of varicose vein. In the last video, we have discussed about the normal anatomy and the physiology of the lower limb veins. Today we'll talk about the venous pathophysiology. We all know that perforators carry blood from the superficial to deep venous system. It is guarded by the valves which will prevent the backflow from the deep venous system to the superficial venous system. So, if these valves become incompetent, the pressure in the deep veins, that is around 150 to 200 millimeters of mercury during calf muscle contraction, will get transmitted to the superficial vein resulting in the venous hypertension. So whenever there is a large amount of blood which is present in the deep venous system getting transferred to the superficial venous system, so what happens, there will be the vein starts getting modified by itself to accommodate the large amount of blood which is coming from the deep venous system. So in that way there will be damage to the intima and it causes even the loss of compliance. It loses its normal shape and it starts getting dilated and it becomes tortuous to accommodate the large amount of blood, and it causes thickening of the venous wall. So, and there is pooling up of the blood in the capillaries and in the dilated veins, which causes further damage of the intima. So when there is damage to the intima, it causes damage to the valves, because these valves are formed by enfolding of the intima. There is stagnation of the blood in the periphery resulting in the edema of the lower limbs, which causes extravasation of the RBCs from the capillaries into the soft tissue. So there is breakdown of these RBCs in the soft tissue, which causes hemosiderin deposition. So these hemosiderin are engulfed by the macrophage and the mast cells, which causes release of inflammatory mediators and histamine. The release of inflammatory mediators causes fibrosis and it causes skin thickening, and this hemosiderin deposition causes pigmentation, and the histamine release causes itching, and with constant itching there will be superficial skin breakdown. Both combined together gives rise to the venous ulcer formation. So now we'll discuss about the risk factors involved in developing the varicose veins, that are advancing age, female, multiparity, prolonged standing and obesity. So in females in their reproductive age group, so the progesterone and the estrogen mainly the progesterone causes the relaxation of the smooth muscle fibers, resulting in passive venous dilatation. So and pooling up of the blood, as you all know, causes valvular dysfunction and development of varicose veins. So what are the symptoms? So patient comes with dull aching pain or heaviness at the end of the day. That is because the calf muscle contraction is causing the shift of large amount of blood from the deep venous system to superficial venous system, causing heaviness, so that patient can perceive it as pain, and there will be swelling usually at the ankle and pruritus because of the histamine release, and there is a condition called as venous claudication. It's a cramping pain that occurs during the exercise and it gets relieved with rest and leg elevation. It's mainly seen in deep vein thrombosis. That is because whenever the person is exercising, or whenever there is activity in the muscular activity, there will be production of substance P. So that gets carried away from the muscles by the venous circulation. When this venous circulation gets blocked, there will be pooling up of this substance P, causing resulting in pain. So that is perceived as claudication pain by the patient. So whenever you raise the leg of the patient, the venous return improves and the substance P gets washed out, so causing relief of the pain. So coming to the physical examination, the patients are examined in both standing and the supine position. Standing position makes the varicose vein more prominent, and you can make out what are the veins which are involved and what could be the probable cause. So three categories of primary venous insufficiency: telangiectasias, these are small intradermal venules measuring less than 3 millimeters, and this can also be seen in autoimmune disorders such as SLE and dermatomyositis, and also in xeroderma pigmentosa, so which is a DNA repair defect resulting in skin cancers. So reticular veins, these are vein branches communicating with the superficial and deep venous system. So varicose veins, these are nothing but the dilated tortuous veins of the superficial venous system. So location of the varicosities and its importance. So whenever you see a varicose vein along the medial side of the thigh, so that means it is involving the great saphenous vein, and the main pathogenesis is due to incompetent saphenofemoral junction. That means there is a reflux from the femoral vein into the great saphenous vein, causing dilatation of the great saphenous vein along the medial side of the thigh. And varicose veins in the medial side of the leg, that is mainly because of it is involving great saphenous vein due to perforator incompetence. Whenever the patient is standing, so whatever the pressure in the deep venous system is getting transferred to the great saphenous vein. So posterior part of the leg involves the short saphenous vein. It's mainly due to incompetent saphenopopliteal junction or the perforator incompetence. And varicosities of the scrotum is mainly due to gonadal vein incompetence. For example, so left renal tumor causing left renal thrombosis. So why there should be a varicocele? Why there should be development? Because the pampiniform plexus of veins, which is draining the testis, will drain forms the left gonadal vein, which drains into the left renal vein, whereas the right side, the right gonadal vein, directly drains into the IVC. Whenever there is compression of the left renal vein, so there will be increase in the pressure of the left gonadal vein, resulting in the dilatation of pampiniform plexus, which is known as the varicocele. So there is another syndrome called as nutcracker syndrome, caused by the compression of the left renal vein between the aorta and the superior mesenteric artery. Perineal or the vulvar varicosities are mainly due to internal iliac or vein obstruction due to pelvic tumors, mainly the ovarian tumors or the bulky lymph nodes. So signs of advanced venous insufficiency, that is, one is hyperpigmentation, we discussed earlier only, because of hemosiderin deposition in the distal calf or in the gaiter's distribution. This is the area which is situated above the medial malleolus in the distal 1/3 of the leg. Lipodermatosclerosis is nothing but the brawny edema of the distal calf due to chronic inflammation, giving rise to the inverted champagne bottle appearance. That is because there will be edema of the swollen part of the calf, and due to fibrosis in the distal part of the leg, so that gives rise to an mainly the inverted champagne bottle appearance. So in the advanced cases, there is fibrosis of the Achilles tendon, giving rise to equinus deformity. This is mainly because of the foot is in the plantar flexion. So whenever you are examining the varicose vein, you need to examine even the movements at the ankle joint. So coronophlebectatica is a condition where there is telangiectasias or venous flare, usually located over the medial malleolus or the dorsum of the foot. So next, coming to the venous ulcers, they are usually vertically oval in shape, situated above the medial malleolus, above or at the medial malleolus, and they usually have the sloping edge with surrounding hemosiderin deposition and fibrosis. In the next video, we will talk about the investigation and the treatment of varicose veins. Thank you.